Hello, everyone, and welcome back to Black Mental Health Matters. I'm Dr. Kerryann Williams, and on today's show, I'm going to be speaking with Dr. Gabriel Felix. We're going to be talking today about depression and anxiety in Black men. So, if that's something that's of interest to you, then keep listening.
Hello, everyone, and welcome back to Black Mental Health Matters. I'm Dr. Kerryann Williams. I'm a psychiatrist here in Massachusetts, and this is a talk show that's about all things related to mental wellness in the Black community. So, if you want to participate in today's show, you can give us a call at 617-238-7111, or you can join the live stream. We're going to be streaming live on Facebook on the page Urban Heat 981 FM. And guys, well, today is going to be my last day on the Urban Heat, but my show will live on. It'll live on Facebook Live and YouTube Live. So you can add me on Facebook and add me on YouTube at Dr. Kerryann. That's Drkerryann. If you want to keep watching future shows. And today on the show, I have Dr. Gabriel Felix, and Dr. Felix is a resident psychiatrist at Cambridge Health Alliance and part of the Harvard Medical School program. And so I want him to kind of tell us a little bit about himself. And from the show that was before mine, 365 Dad, Marv had a question about whether or not Dr. Felix had a six-pack. So, so Dr. Felix, introduce yourself and let us know whether or not you're fit.
So thank you so much, Dr. Williams. I guess to address the six pack, I guess I do have a six pack under the fat that I have under my
Under the
stomach.
layer of fat. It's hidden. It's
Yeah, so
hidden under
I
the
keep
layer
it
of fat.
protected.
It's well protected.
But yeah, thank you so much for having me on the show. My name's Gabriel Felix. I'm a psychiatrist resident at Cambridge Health Alliance. I'm a third-year resident. So I'm, in the process of completing my training to become a full board-certified psychiatrist. So I do see patients but through the CHA system. And so I'm excited to be here today to talk about Black men and mental health, particularly because this is a topic that I think sometimes gets forgotten, and I absolutely love talking about it, particularly for me also as a Black man. I know the importance of maintaining mental health, particularly in my profession, so thank you.
Nice. And so, you guys, as Dr. Felix mentioned, we're going to talk about mental health in men. Particularly, we're going to talk about depression and anxiety. And this is just so important for us to talk about. I think sometimes we hear, from Black men in the community, it's just a sense of like this need to just take care of things on their own. And so, Dr. Felix, as a Black man and as a psychiatrist, tell us a little bit about why is it important for us even to talk about this idea of mental health in Black men and depression and anxiety?
Yeah, I think it's really important when you think about, the statistics, right? When we look at all the data on the Mental Health America, on the National Institute of Mental Health, there's so many numbers that show us that, compared to other groups, Black men, unfortunately, are the least likely to be able to utilize mental health resources, suffer, a significant degree of effects from, unfortunate from negative psychological effects from what may be going on. And when we take into consideration, everything that has been highlighted in the pandemic, with racial oppression and whatnot, the effect on Black people, particularly Black men, has been so significant that it needs to be addressed, particularly during these times where, everyone is suffering. And we have to take into consideration all of those different pieces that may play a role in our mental health when, for many of us, it's not something that has been emphasized or even taught to us from a young age.
Wow. So with all of the things that are going on, people just expect men to just deal with it, like just to kind of carry the weight of the world on their shoulders, just deal with it, just be strong.
Mhm.
And not necessarily a lot of people are talking about how can we help our men to be strong? How can we help them to bear that load? Um, and so it kind of brings me to this idea of how can we recognize that a person even needs support? Like what does depression look like?
Yeah, so when we think about depression, I like to think about it in four different ways. What's going on in your mind, what's going on in your behaviors, what's going on in your emotions, and one thing that people forget, what's going on physically in your body. And in the diagnostic statistical manual, the DSM that we often utilize, there are a different number of symptoms that covers a wide range of things that encompass depression that many people may be familiar with, but some people may not be. And so when we talk about the idea of depression, first and foremost, it's this persistent feeling of having a low mood or excessive crying, just generally feeling low in terms of your emotions. But then there are some other things that also are affected by depression, particularly sleep. For some people, sleep might be happening more than usual, so they're sleeping either too much or they're not sleeping enough. And sometimes people find themselves waking up really early in the morning. Um, Another thing that might be affected related to sleep is someone's energy levels. So for some people, their energy might be decreased to a degree where they feel like they can't get out of bed. They feel like they don't have much motivation to do anything. They just generally feel like they are not themselves. Some other things that get affected are appetite. That's the part in your body. Some people may be eating too much or maybe be eating too little. That either may be a coping strategy or that just might be an effect of your mood. And then there's some other things such as like feeling guilty for how you're feeling, having a loss of interest in activities. And particularly for men, one thing that I ask them is, have you noticed that, for sexual activities, you've had a decrease in interest? And do you think that's related to your mood? And so when you think about all of these things, the causes of depression, it's multifactorial. So it can be related to negative thinking patterns, it could be related to stressors, it can be related to family history, which a lot of people don't talk about. It can also be related to what you're putting into your body, what type of food you're eating, if you're using any drugs or substances like that. And, particularly in these times, it can be related to trauma and loss. Especially now, we know that, in our communities, we're seeing such a disparity in terms of vaccine access, in terms of the actual amount of people affected, and leading to a serious illness from COVID. And so all of these things can affect someone's mood.
Oh, so I mean, so a lot of times we think depression is just sadness. We think, oh, depression is kind of like feeling down and it's just feeling kind of like the world is on you and you feel heavy. But there's like so many things that you mentioned that can really lead to it. And family history we don't really talk about. So the parents also kind of had similar issues. The grandparents had similar issues, and now you have similar issues. And I imagine that someone might just say, "Hey, that's just the way we are," and they may not realize that, hey, that is actually something that is treatable. No.
Mhm. No, absolutely agree. And, for family history, I really do impress upon people to really start those conversations, with your family, with kids early on in terms of, what it looks like, to be happy, what it looks like to be sad, what it looks like to be worrying about different things. And to just kind of talk about, maybe some of the struggles that people have gone through. I think one of the saddest things, particularly, and you're aware of it too, when you are doing intakes of certain patients, and we ask about family history, and more commonly than not, particularly with my Black patients, they say, "Well, I don't really know what went on in the family. I think something went on, but nobody really talked about it." I hear that so often, and it's so sad because I think for many of those people, it would be helpful to know what goes on in your family so you can identify if something may be going on early on instead of when it gets too late. Particularly when we talk about, substance use, we talk about the way people have been coping, or, just the way that we think about, how we're feeling.
Yeah, no, that's absolutely right. I do notice a difference with that as well in our practices. When we have Black patients or clients that come and you ask about family history and aspects of family history, there's a lot less that's said. People, they're like, well, something happened or this person passed away and we don't know why. And so, we don't know this, that person died by suicide or they died by overdose or that, or that it was a medical condition or, there's just not a discussion about people's illnesses and how people passed away. And so then we have no idea for the things that might be inherited, and that can be treated. So you go to the doctor and you don't know your family history, and it is more common in. I do notice it is more common in Black patients and people from other countries as well. Like kind of like
Mhm.
a kind of certain cultures. But that can contribute to you knowing, is this a depression? And
Mhm.
then you mentioned trauma and loss. And you're right, like more recently, it's been recognized as something that's really affected us as a generation of people. I think I know that for many years, it's kind of been the sentiment of why can't Black people just get over the past? Why can't they just move on? We have laws now. The law says you can't, basically, the law says you can't do these certain racist things. So you should just move forward. And there's not really acknowledgement of like generational trauma and loss and grief and continued oppression and how that might actually contribute to mood. And so I'm glad that you mentioned it because I think it does need to be spoken about.
Mhm.
Mhm.
Yeah, I think it's really important to you really emphasize, how, racism, structural oppression really affects us, and understanding that, it's not something that you can't go get over because it's still happening today. We have laws, but as we can see, in politics, in the community, there are ways that people still are oppressed, particularly due to the color of their skin, and that trauma, as we know, even in the science, that trauma can get passed down in terms of generations. It can predispose people to mood and anxiety disorders. And when we think about, the oppressive things going on now, depending on people's income, their ability to get jobs, their ability to basically live meaningful lives, racism is particularly, prevalent in our communities, unfortunately.
Wow. Wow. And so what about anxiety? Are these things kind of related, or how can we recognize if a person, particularly for Black men, how can they recognize if they're if anxiety is becoming a problem? Like, how do they know?
Yeah, so I guess in terms of thinking about what anxiety is, I like to think about it as a future-oriented fear. So you're worrying about different things in different ways, and it's, stress about things that might happen or are about to happen. And so this can, take shape in many different ways, similar to depression in terms of, you being triggered by something and that leading to some type of, worrying or, thinking pattern that's repetitive. And for certain people, anxiety can take different forms, as I said before. So you can have, anxiety related to a specific thing that can lead to, let's say a phobia. The anxiety can take shape in the way of doing certain behaviors. And so they might be these repetitive tasks, like people, who, check their door to make sure it's locked. Not let's say 3 times. I think that's normal. Let's say 5, 6, 7, 8 times. That can happen. And then there's that anxiety about, about being around people, that's social anxiety. And that's where you can lead to, people avoiding certain people, avoiding groups just because of the fear of being ridiculed, embarrassed, or criticized. And it's to a degree that is not necessarily rational. So when I tell people to, when they start having these thoughts or they're avoiding certain people or certain things, that it's getting in the way of them living meaningful lives, I think that's always the goal, is to live a meaningful life. Then I think that's a sign that you might be anxious about something. And I think, in general, a certain level of anxiety is helpful because it can actually help you to realize that you might need to change something or that something might be going on. But we also worry about it getting to the degree where it becomes a disorder. So it impacts someone's functioning, someone's ability to live. And so when I tell people to look at anxiety, I tell people to, kind of get a sense of, what are your general patterns of behavior? What are you feeling inside of your body? Does certain, activities or people make you feel like dizzy? Does it, cause you to have stomach aches, start to tremble, starting to shake, things like that? I think are good signs that, you might have anxiety about something.
Yeah, yeah. And as you mentioned, the physical, because, and you said the same thing for depression too, that there is the physical aspect of it, because we often think of these things only as a mood thing, that this is just how I feel anxious, I feel depressed. And I imagine then for a group of people like Black men that are kind of taught that they need to be strong and they can't show emotion openly in certain ways, that so commonly the emotion kind of starts to manifest physically. So they have physical problems, stomach aches, headaches, dizziness, chest pains, what they think might be heart attacks. Tell us a little bit about how sometimes physical signs can be a sign that actually you're depressed or anxious.
Yeah, and I think that's important. I think that a saying that I take from a book that I enjoy. Your body keeps the score, or the body keeps the score. I think that is a perfect, explanation for what's happening. Particularly when we talk about Black men, and this is not obviously representative of everybody, but typically what I see is that people, particularly with Black men, we're not necessarily taught to express our emotions in a certain way, in terms of if we're feeling stressed, if we're feeling sad, if we're feeling anxious about something. It actually comes out many times through like irritability or anger. And, given the constraints and the context of, Black men in society, many of us are taught to kind of damper or kind of bear, like you said before, those emotions. But when we do that, there are physiological changes, like your body chemistry changes, where it increases these stress hormones. And so
Mm.
with these increasing stress hormones, particularly cortisol, if it's elevated to a certain degree, that can lead to things such as having high blood pressure. It can lead to you feeling like you're having headaches. It can feel like, you're having stomach aches, and that's because your chemistry is off. And, I think a lot of people don't take that into consideration until it gets too late. Your body will manifest that stress in some way. You may not see it directly in emotions in terms of, someone crying or something like that, but it may take a different may take a different route in terms of getting itself out, because your body is signaling that something is going on. You're stressed. That's why your blood pressure's up. You're in a fight or flight mode. So when you see those types of symptoms, even leading to certain things like chronic pain, that might be a sign that there is something off in terms of that mind body connection, which I don't think many people really realize is so interconnected.
Yeah. And I think, and it's interesting is that I find that women are more likely to think about the mind body connection, because women are thinking about like the yoga and the various kinds of things. So I noticed that Black women are they're more in tune with that kind of like mind body thing, but Black men maybe not much as much so, but they should be. They should be thinking about it, even though they may not necessarily need to do the exact same things, but they should be thinking about it and thinking about like how they can address that. So you mentioned that anxiety is kind of like a future-oriented fear of the things that might happen or the things that are about to happen. That what that kind of makes me think of, right, is when we're looking at anxiety, how sometimes there's a sense of what do you fear, and is your fear realistic? And in particular, in a world where a lot of Black people have kind of been gaslighted about racism, there's sometimes a sense of like, well, what you fear about your potential experience isn't realistic. Well, why are you afraid of being pulled over? That's not realistic. Those are just a small minority of cases that are mistreated by the police. And then there's a sense of, okay, well, should I be anxious about this? I guess, do you have any thoughts about this idea of anxiety when it comes to fear, the things that could happen in the future, realistic fears and that sort of thing?
hmm No, yeah, and I think you hit it on the nail on the head in terms of that. Um, and particularly when we talk about the police, because even personally myself, even when I'm driving and you see like a cop car and like the lights start, shining, and it's like, is this for me? Is this for somebody
Yeah.
else? Oh, or is like, are my lights working? Do I have access to my ID in a place that doesn't look like I'm reaching for
Suspicious, like
something?
you're reaching for a
Right.
gun.
Right. And this is all happening in like split moments. Like, just from me seeing these lights flashing behind me, or even just like a cop driving behind me relatively closely, they could just be doing whatever, or they could just like, oh, this person looks nervous. I go through this thinking pattern myself, which kind of even takes me out of the moment. I'm just like, oh, I have to make sure everything's fine. Oh, am I playing like music that's going to make him think a certain way about me? I think a lot of, the fears, and we talk about anxiety, are realistic things. The fact of the matter is that it gets to a point where it's affecting us either physically or psychologically, to the degree where we may even avoid, dressing a certain way. We may avoid going to certain places. We may have to change how we speak in terms of how we are at work. I think a lot of those anxieties are based on reality. The unfortunate part is, we can't guarantee whether it's happening or not. And so when we build up that anxiety for something and it doesn't happen, we kind of second guess ourselves. And then when it does happen and we're caught off guard, we build anxiety again because we're saying, oh, I should have known to do that. I have to be prepared for next time. So unfortunately, it goes into this cycle of thought that isn't based off of something that's not true, but it's based off of our unfortunate reality in terms of dealing with racism, microaggressions, and police brutality.
Yeah. So I guess it's important then for people to know that when we talk about anxiety, it's not always things that are not possible or things that are completely irrational. We can have anxiety about things that are totally real and totally possible, but really it's kind of you're thinking about how much is it affecting your life, your daily life. You mentioned like your functioning essentially. How much is it affecting your decision making? What you dress like, what music you listen to, how you talk. How much is this fear kind of changing who you are and affecting your life? And then I guess, do you feel, I guess I would even add, do you feel like you can't control how much you're worrying? Does it feel like it's gotten out of control? How much you're worrying?
Yeah, and I think that's the important part of it. I think recognizing the anxiety is the first step to, being able to manage it. So the thing about anxiety is that just because it happens doesn't mean that there isn't anything that you can do to kind of cut those effects, to kind of manage how things are going. And so for me, when I talk to people, I think, when you can actually name what's going on, when you can notice those sensations going on, and kind of maybe using some breathing techniques or counting backwards, any type of coping skills. What happens is that when you get really anxious, there's a part of your brain, the amygdala, that controls emotion. It just overpowers everything. So even like for the rest of your brain that can help you in terms of executive functioning, in terms of making those decisions, you need to find a way to calm down those emotions so that, oh, I'm feeling anxious right now for a good reason, but doesn't necessarily mean that I need to be overwhelmed and that gets in the way of my thinking, because I think that's what typically happens is that people will eventually, have this sense that they have no sense of control.
Mm-hmm. Yeah, exactly. And that's when something needs to change, because
Mhm.
it's normal to feel anxious and it's normal to feel depressed at times, but when you feel like you now have less control over what's happening, then things are kind of starting to venture far. Um, so we're looking at mind, behavior, emotions, how things affect you physically. Um, I wonder, are there any other kind of signs or symptoms of depression or anxiety that maybe we haven't spoken about that maybe people don't even recognize are a sign of issues with your mood? I'm trying to think if I can think of anything else. What else? I mean, we talked about physical.
Mhm.
I think, sometimes people will just call things stress. They'll just generally say it's stress. And sometimes stress is actually depression and stress is actually anxiety. Would you agree with that?
Oh, absolutely. And I think depression and anxiety actually go hand in hand many of the times when you think about it. So I think what many people don't realize is that sometimes it can take the form of everyday habits that we have in terms of depression and anxiety. So if you're a person who sets like a high bar for perfectionism, or feel like you have to set very high goals for yourself all the time, we're human beings and we make mistakes, but many people, they're able to get over that. For other people, it leads to this consistent feeling of being like a failure. Then that leads to self-criticism, where it starts to lead into things like feeling guilty, shame, feeling like you're, less than other people. And that can kind of evolve into catastrophic thoughts. And so that anxious thought, those anxious thoughts about, oh, I have to do this, I have to do that. If I'm not doing it, I'm a failure. When that cycle repeats, that can affect your mood and that can actually lead you to feeling depressed. And it can even get to, a significant degree where you start to have like thoughts of, oh, I don't want to live anymore. And you mentioned the suicide, which I think is really important to, always highlight because it doesn't get talked about a lot. And particularly for, for Black people and, Black teenagers, Black male teenagers, the rates of suicide are actually really, really high. And a
Yeah.
lot of people don't really notice that or recognize that. So I think one of those things, I tell people to watch out for is what I call those thoughts of not wanting to wake up, not wanting to live anymore, particularly with my spiritual group when they say, oh, I wish God would just take me now. I try to be very conscious of those thoughts because they're telling you something. They're telling you that, there's something about life that isn't worth moving on for anymore. And then we had to recognize and identify what is causing you to feel that way.
Wow. So for folks that are listening, if you kind of are at that point where you're thinking, you're just going through the motions, like you don't feel motivated to keep going, you feel like, what's the point? That is definitely a sign that you're struggling with kind of some moderate to serious depression. Um, and as Dr. Felix mentioned, it can sometimes take the thought of the form of these like kind of spiritual, like, oh, I wish God would take me now, kind of. So it sounds almost like a very kind of holy thing, but it really is a hopelessness thing of like, I don't see my purpose, which is also kind of not in line with what most religious groups would kind of say. Most times you're trying to find hope in your existence and what's my meaning and purpose in life. Um, so that's really interesting to kind of to note. And I guess for those of you listening, there's definitely information out there. I mean, literally, if you Google the word suicide hotline, you will have a couple of numbers that pop up. And I think Google even has a little thing that says, do you need help? There's a chat that pops up. So there's a lot of ways to get help if you need to talk to somebody. Just Google suicide hotline. And or try to talk to one of your physicians, your PCP. They can kind of hook you up with somebody to talk to. So, for those of you that are listening, if you have any questions, you can give us a call at 617-238-7111. That's 617-238-7111. And you can also follow us on our Facebook live stream. That's on the page Urban Heat 981 FM. So you can drop a comment on that Facebook live stream. And today we're talking about depression and anxiety in Black men. And I have with me Dr. Gabriel Felix, who is a psychiatry psychiatry resident at the Cambridge Health Alliance program with Harvard Medical School. So, we'll talk a little bit more about all the different kind of things to think about with depression and anxiety, but it also makes me think about what can we do about it. So, there's kind of like I always kind of put this in two camps. There's the things we can do on our own, and then there's the things that a professional can do for us. And then there's ways to address depression, and there's also ways to address anxiety. Sometimes those ways overlap. But let me maybe start off with, what are what are ways that Black men can start to think about addressing depression?
I think the first step is learning a little bit more about depression and why, they might be feeling depression. I think people, kind of jump to doing these activities. But I think really taking a step back to really think about what's going on that I'm feeling this way. And the way that I like to educate when I talk to other groups about, Black men and depression and anxiety is I like to split it into two big camps. So I think for Black men, we talk about being Black, this identity that we have, but also the identity of being a man in terms of masculinity or the masculinities that we have. And I think we really need to take a look back in terms of what is shaping our idea of what it means to be, a man in society. And that comes from, family, it comes from the media, it comes from friends, it comes from our social groups. Many of these things keep getting reinforced. And when we think of masculinity in general, it's this idea that we're supposed to be dominant, we're supposed to, win at all costs. There's a high level of competition, aggression, success, things like that. And then when we think about what it means to be Black and what that means in this country, I mean, it obviously isn't, these are all social constructs that we have, but it obviously has meaning, and it's had meaning for us for, the beginning of time, honestly. And when I tell people to think about those two things in terms of, how racism is affecting you, how your idea of yourself, how your family or your social group has, created this norm or this gender norm that you have to follow, and the conflicts that go in with these, different constructs and how you're functioning in society, then we can, have a conversation in terms of, well, how do you view yourself? How do you view how you're moving in your society, in your family? do you have the pressures of like being a provider, a caretaker, the successful person, a father, any of these things? And do you feel like it matches up with who you want to be or who you think you should be? And then we move on into, why they may not think that they may not be there. And that kind of goes into some of the social issues that I talked about before. And so once we have that idea of like how this person is actually viewing themselves, then we can talk about, okay, what can we do or talk about to help you get to a point of the person that you want to be or to have, good psychological well-being. And this goes into different aspects in terms of thought patterns. Are you someone who calls yourself a failure as like, oh, I'm not good enough, or I'm just no good, or I'm trash, all of these different terms that you hear people saying. And then I say, what can we do to stop those thoughts? That's the first thing. Then I say, what is, wellness look like for you in terms of your physical symptoms, right? Because we also know that we're at higher risk for, high blood sugar, diabetes, hypertension. What does your diet look like? And obviously taking to a fact that there has also been structural oppression or what I call food apartheid in many of our
Oh
communities.
yeah.
Then we have to have that conversation in terms of like how can we get you to be live have a healthy diet in a sense. So how do we get you proper nutrition? um, and then figure out, how can we get you to do things that may get your body moving, like exercising, learning breathing techniques, setting priorities. Um, and for many people, it's hard, right? Because I mean, life isn't easy. Many people, and Black men, have multiple jobs, or unfortunately, with the way that mass incarceration works, having interactions with law enforcement or the criminal system, things like that. It really takes a lot of, identifying these different pieces in terms of the thoughts, all the way to like, what are the big picture things that are affecting you as well? And how do we get you to a place where we can, get you to a point where you can move in society in a way that is to the benefit of your mental well-being? And so
Mm-hmm.
I tell people, things like exercising, breathing, breathing techniques, those are things that you can do yourself. Because, people ask me about therapy. Therapy, unfortunately, is still not cheap. There are options, obviously, but when people hear that, they hear the money sign and then they automatically turn off, because I think that's just the general automatic reaction people give. But there are certain things that we can do ourselves to make sure that we're doing well. And, checking in on yourself. Ask yourself how you're doing today. Am I happy? If I'm not happy, why? What makes me happy? Or what is my views of being happy? And is this something that is meaningful to me in terms of my values, or is this something that I was just told I need to do to be happy? Which I think a lot of people struggle with as well. This idea of what you should be versus what you want to be versus who you are.
Yeah, wow. And it just kind of strikes me because I think it's not a one size fits all, which I think sometimes when people talk about what others should do about their depression and anxiety, they often will just say, get a therapist. And I like that your approach is, wait, let's step back and examine what's going on for you specifically. What is the cause of your depression? Um, what does wellness look like for you? Because it isn't one size fits all. And I've noticed that, whenever you hear people tell their stories, that often the solutions people find are so varied, right? I always kind of think how for some people, the solution was going to therapy. For another person, the solution was starting to go running. Maybe they started to train for a 5K or a half marathon or something. And that's actually one of the ways that brought them back to wellness. Or another person may have found their meaning in giving back to the community in some way, and they kind of reconnect with themselves and say, here's what brings meaning to me is helping people in this other way, and they kind of start a foundation, or they start a group, or they start a organization, or whatever. So kind of taking that step back and saying, what's important to me? What does wellness look like to me? And kind of what's the cause of my depression? What is it in my life that's kind of leading to this stress? And also the nutrition, which so many of us really underrate. Really underrate that. As you mentioned, this kind of food apartheid. It's a great way to describe it. Um, that we underestimate how much that affects both our physical and our mental health. And so we kind of think, well, why can't these, quote unquote, why can't these Black people just kind of do these things and just pull themselves up by their bootstraps and do this and that and just kind of get themselves out of situations? And it's like, well, there's a lot of factors, and one of them is actually nutrition, out of so many other things too. And that should be addressed as we talk about mental health, because that has direct links to our mental health as well. Um, so anything else to add? And in particular, with addressing anxiety as well, anything different, or is it kind of the same things for anxiety?
Yeah, I think it is the same, similarly for anxiety. Again, for many of these things, a lot of it isn't necessarily in terms of changing the situation at its moment. There are certain things that we simply can't avoid, whether it's things with school, work, our families, church for certain people. Because I mean, we talk about spiritual well-being as well. I think there are certain situations that we can't avoid. It's just how we have to think about how we're thinking about these situations and how our body reacts to these situations, and thinking of coping strategies or techniques to really help get our body back into an equilibrium. I think particularly for anxiety, those thoughts can, affect those emotions, those behaviors, and if that gets reinforced or if it gets avoided, which a lot of people will do in terms of whether it's responsibility, whether it's talking to their partner, whether it's, interacting with family members. What it does is when we avoid that situation, our mind solidifies like, oh, we avoided this and I'm okay. So the next time that this happens, I'm going to do something to avoid this from happening again. Or if you're someone who self-medicates and you say, "Oh, I'm feeling really anxious right now. Let me have, a shot, or let me like smoke something or do something," and your body was like, "Oh, doing this helps me to avoid, those symptoms that or those physical sensations or even those thoughts from happening. Let me do it again." And
Oh,
so being able to notice what's going on there, those triggers, and then your response to it are really particularly are important, particularly when we think of substance use, but also when we think of how we're behaving in our environment.
wow. So you kind of bring up something important, which is this idea of people using avoidance as a coping strategy, and that can sometimes be substances, because it basically serves to almost like extinguish the feeling without you having to actually deal with it, or to deal with what the source of the stress is, the source of the depression, the source of the anxiety. You just avoid it by taking something that just kind of like immediately gives you relief. um, and particularly when it comes to treating anxiety, avoidance is not a good treatment for it, because it can reinforce this kind of cycle of just having all the same stressors that are not changing, and then just taking something that then can become a habit forming kind of substance of varying degrees. And then you end up with another problem. You end up with a problem of not having control over substance use, whether you feel like you have it or not. After a while, you get to a point and it's really controlling you, that sort of thing.
Mhm.
So,
Yeah,
so I don't know if you have something to add about that.
no, yeah, and I think it's particularly important when we talk about Black men, right? Like substance use affects everyone. It doesn't discriminate, but when we think about the long-term effects of it, and when we talk about access to care, um, the long-term effects, particularly in Black men, can lead to very lethal consequences. When we're talking about overdose, we're talking about damage to your liver, damage to the rest of your body, and I think it's something that really needs to be talked about because many times when we talk about alcohol use, people say people generally kind of underplay how much they drink or the context in which they drink, and we're Black people, we're really good at our vocabulary and kind of it's like, oh, it's kind of like we were just lit at a party. It wasn't anything too serious. But when you ask us like, so how much did you actually like have to drink, or like when you're feeling stressed, when you said you had like a glass of wine or anything like that, how much was it? And when you hear the number, you're just like, wow, that was a little bit more than I thought that whatever they said actually meant. So I always like to really take time to hone in on that substance use and see what are you actually doing to cope, how does this actually show up. And I don't even know how often you may see a doctor. So if I have if I can do something at this moment to really talk about it and educate my Black men particularly about the effects of any substances, I'd like to do that now. So at least that you're planting a seed of some sort.
Yeah, yeah. And one thing I always like try to remember too is in the Black community, substance use has different implications than in other communities. There's often more more kind of legal involvement around it.
Hmm.
I was a couple of weeks ago talking with Dr. Kevin Simon about adolescent substance use and this difference between in a certain neighborhood with a Black teenager, if they're found with a substance, they get brought to the police station. But in another neighborhood with a white teenager, they're brought home and they're kind of given this second chance, and the family says, well, slap on the wrist, don't do this again. And so depending on where you are and who you are, the
Hmm.
implications of intoxication may be different. And so that's one thing to kind of think about, that that's the society we live in right now. And as you mentioned too, the idea of what are the kind of implications health wise, and do you have the access to care that you need in the event of an overdose or in the event of other kinds of things going on.
Hmm.
Yeah, yeah. Um, so I guess, oh, the other thing I wanted to mention about that too with substance use was, sometimes what I find, and this is kind of a whole nother bigger discussion, but some of it I found with clients that I treat is actually related to mistrust of the healthcare system. This idea of I'm just going to take care of myself. I would rather drink this thing or smoke this thing than to trust the healthcare system to take care of me. Sometimes I've seen that kind of play out as well. Of like, I know this is kind of not a great habit, but at least I'm the one that's kind of I'm choosing this,
Hmm.
versus this feeling that if I entrust my care to a physician or to a medical system, then all of a sudden I lose control. And so that's kind of a whole other discussion, but it can sometimes factor in. But it's still not the best way to deal with emotional problems.
Hmm. Yeah, that has a lot to do, with stigma, overall. And, I always like to frame it this way. I don't think it has to do with the mistrust. I think that puts the onus on Black people. I think it's the untrustworthiness of the system. When we think about historically how medical institutions, mental health professionals have treated Black men, Black women, Black people in general, it's really not surprising why many people wouldn't trust medications. When we think historically, like there were certain, like even in the civil rights, there were certain medications, antipsychotics, they were thought to be used, for the civil rights leader because they didn't know what they were doing. We even had like medical terms like drapetomania, which basically was this psychological illness, going back to slavery. And it's like, oh, why do these slaves want to escape? So I don't blame us in terms of that untrustworthiness. I blame the system in terms of its history, and there has to be a lot of reconciling that needs to occur. So
Yeah.
particularly when we talk about, especially when I have a Black man in front of me, because again, the other issue is that many times when I'm seeing, particularly where I am, Black men for mental health, it's in emergency settings. It's not
Yeah.
necessarily in the outpatient setting. It's because someone was brought in by the like law enforcement or like by the ambulance for a crisis that may be happening. And so when we can finally get to the point of stabilizing them, I like to have those conversations that I talked about before, because again, they're just brought in from whatever situation and then they're expected to just do what they're being told. And that is so oppressive in a sense that it's not collaborative. I like to collaborate because again, when we think about this idea of like masculinity, it's not necessarily like encompassing all of it, but for me to be telling this person, oh well, you were doing this, or you're depressed, you need to take this medication now, or you need to go to therapy, that's not the best way to really build a professional, any type of relationship with someone who may be struggling with their mental health.
No, that's absolutely right. And I think actually the studies do show that when it comes to there's a discrepancy when it comes to patient race and how the medical system deals with them, whether they deal with them in a kind of very paternalistic, let me just tell you what to do fashion versus a very collaborative, you're a participant in your care, that there are discrepancies with how providers interact with patients of different races. And so that does contribute to some of that feeling of a loss of control, that provider didn't really ask me a lot about like what my thoughts were, or if they asked, they felt very bothered if I didn't agree with them. So there's kind of like a implicit sense of like, yeah, I asked you how you felt, but really I just wanted you to say yes.
Mhm.
um, And people don't appreciate that. Why would they, right? So, but I say that, like, there's been so many times where I've had patients that are Black patients that come to me, and I don't feel like I'm doing anything differently, but they will say that this is kind of like the first time someone actually sat down and listened, to actually really heard what they were saying. And in my mind, I think, what are the other people doing? And I think what it is that people don't realize when they have implicit biases. They don't realize that they're talking to people differently, they're handling them differently, they're being paternalistic, they're just asking them to do what they want them to do. And people are kind of, yeah, they're feeling kind of put upon, yeah, by that. So that's absolutely true. That the healthcare system has not really done a good job of making themselves trustworthy. They still haven't. It hasn't really changed much. Um, so it's interesting. It's interesting because you think, I think folks are trying to, but it really hasn't changed much in terms of how they handle patients of diverse backgrounds.
Mhm. Yeah, and even taking it to like an extreme but not extreme example, I mean, that leads to, certain misdiagnosis, right? When there's not that cultural awareness, or that, if you're not a woke doctor and you're not really aware of what's going on. And, it was interesting because I had a colleague who was telling me about a black patient, a black man patient, a black male patient that they had. Um, and they kind of called, this his idea of being afraid of the police a delusion.
Oh, wow.
And I was just like, when I heard, I thought it was a joke at first. I was like, no, they couldn't possibly think that in this day. And just like, no, it's like we really thought, like, he thought like the police were out to get him, like we were all being racist, like all of these different things. And I'm like, well, did you take a moment to consider that, he's probably had experiences with the police that were unjustified, or, any situation in the mental health system or like the medical system in general, that would lead him to believe that. And it was like, I guess now with people being more aware of it, it was like, I guess now we did, but at the time that wasn't our consideration. And now
Wow.
in this person's medical chart, it's listed that he had delusions, and it doesn't even necessarily mean that it was explain why he has his delusions. So again, that is just
Right.
another example of why people are mistrustful. Because again, when we talk about misdiagnosis in terms of calling people schizophrenic, or even when we talk about as being spiritual people, like these certain things that would lead one way instead of the other way, it makes sense as to why people will be hesitant to take medications or even see a mental health professional or even see their doctor in general.
Yeah. No, it totally makes sense. It totally makes sense that there would be that hesitance. And so, a lot of times it's then tricky to know, okay, when do we know that we should then see a professional? Like, if there's an average kind of person just listening and they're like, well, I don't know whether I should see or not, like, what should I take into consideration when I am considering seeing a professional? Because maybe that person has tried some things on their own. Maybe, their family or their friends have encouraged them. I think you should talk to somebody, or I think you should go somewhere. What are some things that they should bear in mind? Like, where should they start with finding a professional?
Well, I think it depends. I think, the first thing that you can start with is if you have a primary care provider, and I'm thinking in terms of like cost and coverage, talking about, how you might be feeling. Saying, recently I just haven't been feeling like my best self. I've been feeling a bit sad or more anxious recently, and having that conversation. If you want to look on your own, there are different resources online. You can go to Psychology Today. Therapy for Black Girls is always a good one if you're looking to speak to someone. There's also a therapyforblackmen.org now, that has a list of providers. And I think, talking to people who know you, and people that you can trust. So not only people that know you, but people that you can trust, and saying, I've been feeling a bit differently. Have you noticed anything about me that's changed? Or do I seem more irritable? Or do I seem like I've been getting like snapping or going off on people a little bit more? And seeing what they have to say, because a lot of people will again suffer on their own, and when black men, they bear this load on them until unfortunately it comes out in the way of something that may not be the most adaptive in terms of where they are right now. And so kind of putting like a temperature check with people that you trust, in terms of like, yo, do you think I'm tripping? Like, do you think I'm like going crazy? Like, because again, we have very rich vocabulary in terms of how we go about expressing our emotions, which is why it's important to also find, a provider who is also aware of what that language might be.
Mhm. Yeah, and as you're talking, I'm kind of thinking too that I've sometimes seen people even just start like groups, like they'll start like a men's group at their church and
Hmm.
just have like a group of guys that just kind of do life together and kind of like talk about what's going on. And they sometimes start there, and then the group might weigh in and say, I do think that maybe you should see a professional, or I do think that the group is great, but you may need more than what the group can offer. And I think sometimes people can hear that a little bit better as a starting point. And he said, like, you go to your primary care, because then from there you can maybe kind of think about how to get it within your insurance. Or if you go to some of these websites like Psychology Today, there's another one called InnoPsych. That's kind
Hmm.
of a newer one, and you can check to see whether they accept your insurance as well. I think I think some people can go to their insurance card websites, but I found that to be a bit overwhelming. When you
Hmm.
go to your, like, even if you're looking for any kind of provider and you go to your insurance like website, there's so many providers, and not all of them have openings, and it can be very confusing. But that's another way to find someone in your network. Some people get lucky that way, where they kind of
Yeah.
look at their insurance, but it is a bit more it's a bit more of like finding a needle in a haystack, I think, when you go through your insurance website.
Hmm.
And then for folks who have the means to pay out of pocket, even then sometimes it's hard to find people with openings, but there are more options but it's super expensive when you pay out of pocket.
Hmm. And also, going through your job as well with like employee assistance
Oh
programs. A lot
yeah,
of people
yeah.
forget about that too, in terms of being able to find a low cost, or and sometimes it's even covered. And many times they'll have someone who will actually do the work where you say, like, I want a therapist with this background. If you have race or gender preferences, they can also do that search for you as well. So I always tell people to look through their EAP or see if they have an EAP and see if, that might be an option for them.
Right, because it's totally confidential, and you'd be working with someone that's unaffiliated really with your employer. Because I know as a psychiatrist, sometimes different organizations will reach out and say, "Would you like to be affiliated with our employee assistance program, and we could refer people to you?" So it's like I'd be completely unaffiliated with the program. It would just be a way for them to find a provider for their employees. So that you're right, that is a good way to find it too. And they do the work for you. They kind of do that search. Um, and I guess as we're kind of wrapping up a little bit, what about privacy issues? I mean, do people need to worry about privacy?
Yeah, so I think when it comes to seeking a provider, even in terms of talking to your PCP, your primary care provider, or therapist, we're all held to federal laws in terms of confidentiality. So in terms of if you're expressing anything that you don't want anybody else to know, a therapist is legally obligated to keep that confidential. And of course there are certain circumstances where they have to break that unless there's a concern for your safety or the safety of someone else. When I talk about reaching out to people you trust, I think that requires you to really evaluate your relationships if you want them to know that you're struggling, because the unfortunate fact is that some people may not have your best interests in mind, or some people may think that they're providing advice that or counseling that a professional should be providing to you. So it really does require you to really take a step back and think. If you have a friend that can't keep a secret, and and you're going through something, you may really want to consider whether they're the person that you want to talk to at that moment about what you're dealing with,
It's
because we
true.
all have that friend.
Yeah, and I also kind of as you're mentioning that, I'm thinking the other thing to think about now that people can offer, and this is a plus or a minus, but some people like to do like telehealth. Because then they don't have to necessarily kind of walk into a building or that sort of thing, or walk through a building. Sometimes telehealth providers will still require a certain number of in-person visits, like maybe the first visit has to be in person or things like that. But the drawback is sometimes if you do telehealth, you might have difficulty finding a private space to have your session. If you're at home, if you live with other people, then it might be hard for you to find a spot. So sometimes going to the office is actually the most private spot to be, is actually physically in the office. So depending on what works for you, if you can do telehealth and you have a private space where you are, or whether you need to go to the office, the pandemic has kind of changed that dynamic a little bit, but
Mhm,
but
it sure has.
that's kind of around. And so um, I guess in our last 2 minutes, should people, are there moments where they should consider medications? Is that ever, something you consider for a Black man?
Yeah, and I think that's where it requires you to really reach out to a professional and really talk about what you're going through, and you'll know whether you're dealing with a good clinician or not. in terms of whether they actually explain how these medications work, how they affect your body, kind of giving a realistic timeline in terms of how long they're going to take these medications. Because for some people, one of the questions that I get is like, oh, am I going to take this medication for the rest of my life?
Right.
And, we had to have that conversation, in terms of saying it depends. Some people, don't need to be on this medication long term. And, depending on what you're going through, you may have to be on this medication maybe for a number of years. It depends on what you're going through, and really working together to see what your goals are. And, if you want to get off medication to a certain degree, then having that conversation is important. So I think medications have a place depending on how things are going. And if it gets really to the point where you may have to be hospitalized, I think it's something to consider. And it's not necessarily something that's long term, but it's not the only thing that's gonna help you to get better. I tell people medications will not erase your trauma, medications will not erase your situation, but they can help you in terms of dealing with that situation. And if we can get you connected with, a group, a professional, any type of help, that combination itself is the best treatment.
Yeah, that's absolutely right. I always kind of say to folks that it helps to reduce the intensity. Like it's doesn't make everything go away, but it's like a radio dial. It can sometimes just dial things down just a little bit so they're more manageable. But you're still in control of your life. You still do what you need to do, and you're in control of the medication. The medication is not in control of you. So if at any point in time the risks outweigh the benefits, talk about it. Let's talk about it. But I think also that that's one of the benefits of having a good provider, a good psychiatrist or psychiatric provider, is someone who is, as you mentioned, going to explain that to you and not just say, hey, take this medication or else you're a patient that refuses, but rather they will kind of discuss here's what's going on, and here's what your risks are, here's what your benefits are. So I want to thank you so much for coming on the show today, Dr. Felix. And I want to thank all my guests, my listeners. Thank you for joining me today for Black Mental Health Matters. As I said, today is my last day on the Urban Heat. I want to shout out to Mr. Marv Neal. Thank you so much for giving me a start on the radio. So guys, if you want to keep listening to Black Mental Health Matters, add me on Facebook and add me on YouTube at drkerryann. That's drkerryann. Join me next Sunday at 1 p.m. Eastern Standard Time on Facebook and YouTube Live. So I will see you next week. Have a good week.
Hello, everyone. I hope you enjoyed the show today. For more on Black mental health, you can go to my website, drkerryann.net. You can also follow me on Instagram, also at drkerryann, and tune in every Sunday at 1 p.m. Eastern Standard Time to Facebook Live and YouTube Live at Dr. Kerryann. I'll see you next time.